Okay, so I'm just going to hang on one more minute to let people join us, and we'll then make a start. Okay, I think we'll make a start. Just to note, if you're not familiar with the WebEx system, there is a chat function a little similar to Zoom or MS Teams. So if you do have any questions at the end of the presentations, please just put them in the chat, and Florette is keeping an eye on the chat, and we'll read those questions out to the speaker. So good morning or good afternoon, depending on where you are from. We're delighted that you've been able to join us today. For those of you who don't know me, my name is Pete Simcock, and on behalf of the organising committee, I'm delighted to welcome you to this day one of this third conference organised by colleagues, a partnership of colleagues from Université de Saint-Boniface, the University of Manitoba, and Birmingham City University in the UK. There will be further welcoming comments from each university later, but first I am honoured to welcome our keynote speaker. Described as a champion of the vulnerable and disadvantaged, Professor David Croisdale Appleby, OBE, has been committed to social justice throughout his career. In his role as chair of numerous organisations, he has provided leadership across health and social care and championed not only the needs and rights of disadvantaged groups, but also the social work profession itself. I'm therefore delighted that David will start this conference by presenting his keynote presentation. David, thank you very much.
Thank you, Peter. Thank you for that. And can I say what a privilege it is to have been invited by the three universities to do this introduction. So let me begin. Governments have promised us what is called a just recovery, in which we will build back better to decrease the inequalities and poverty so vividly revealed in the coronavirus epidemic. So let's start with a consideration of what kind of social policy will be required for this recovery. For most of the last century, social policy theory was dichotomized into residual social policy and institutional social policy. Proponents of the former, residual, favor limited state intervention, a high degree of personal responsibility, the involvement of non-profit organizations in welfare, and the maximum use of market mechanisms to meet social needs, believing that government's role should be limited to providing a safety net for those who cannot help themselves and to helping that small proportion of the population that is not able to function effectively in the market. On the other hand, proponents of the institutional social policy model believe that government social policies should cover everybody and provide comprehensive universal benefits and social services for all. They favour extensive government intervention in both the economy and social affairs, and they believe in universal coverage and the long-term provision of benefits. As will be clearly evident, the institutional approach is usually associated with the Western European countries, including the UK, whilst the residual approach is more frequently associated with some of the Anglo-Saxon countries, and particularly the United States. Of course, all of this dichotomous classification was based on the normative social policy preferences of the Western industrial countries. And towards the end of the last century, some social policy scholars began to argue that this dichotomous categorization did not fit the experience of the developing countries of Africa, Asia, and Central and South America, and in particular those countries seeking to promote economic development while seeking to integrate social policies with economic policies. And this led to the developmental model of social policy, or the social development perspective. Whilst this was the origin of the social development perspective, many of us now believe that the developmental social policy approach should not be limited only to the developing countries of the global south, but also applies fully to the countries of the industrial north, with the argument that it can end the separation of social welfare and economic development in the minds of people, experts, and government alike. It differs from both the residential and institutional approaches because it promotes effective social welfare interventions that are, to a large extent, productionist, using social policy as a key way to improve the determinants of economic growth. So with an estimated aggregate of 2% of GDP having been lost during the pandemic to date in the UK, it is this productionist social policy that is being pursued in the UK, as underlined by the crisis budget here of March earlier this year and the latest budget of the 27th of October. The rhetoric being about building back better, whereas the reality is rather different. And the UK government has chosen a high spend, high tax route in direct contradiction of its principles of small state, low government spending, low tax. And inflation over the next 2 years is predicted in the UK to be 5% per annum, with the tax burden being the highest since the aftermath of the Second World War, matched by the highest rate of government expenditure since the 1970s. But this social policy sets its eligibility thresholds strongly in favour of those in work, which is a productivist approach, but discriminates against those not in work through allowing state benefits to be cut or eroded by inflation, and oversees major price rises in fuel and food and other basic living costs. Now, this means that the UK official poverty figure, currently set at 6% of the population, is set to rise alarmingly, and the effect on our most vulnerable and disadvantaged citizens, adults and children alike, will be extremely severe. So the scene is set for what can only be described as a perfect storm of factors to impact very negatively on the most vulnerable people, the people with whom social workers primarily engage. So the task for social workers, already at unprecedented levels of demand, are set to increase much further, with the physical and especially the mental illness pandemic being further exacerbated by more families in poverty, and the social determinants of health, which we know are so important, being largely ignored. And in the UK, over the past 5 years, we've seen the welcome move to adopt a fundamentally place-based approach to addressing individual area population physical and mental ill health through the move to create 42 integrated care systems, ICSs, which are based on the Spanish system rather than the identically named but very different US system. Our ICSs are designed to provide seamless, integrated health and care services. And as these become more developed and operational, many already are, and indeed all will be by April 22, the scope for social workers to play a much more significant leadership role in creating well-being is an exciting opportunity which social work as a profession must grasp. If it doesn't, we will have missed the opportunity to deliver the International Federation of Social Workers Principle 4.2, which states, as you'll be well aware, that social workers have a responsibility to challenge social conditions that contribute to social exclusion, stigmatization, or subjugation, and work towards an inclusive society. That simply must not be allowed to happen. Now, to use a theatre analogy, now is the time for social work to emerge from the wings into the centre stage in making that challenge to the status quo, but to make it constructively, offering solutions, not merely reiterating problems. In my experience, policymakers have little interest in hearing reiterations of problems. They want solutions. In my 2014 review of social work, I drew attention to the major self-inflicted loss our health and well-being system was suffering through not embracing social work as an important part of it. We must, carpe diem, seize the opportunity of building back better to remedy this. What we need as a system is to make major progress on a number of fronts, of which I'm going to cite just 10, but believe me, there are many, many more. So going through those 10, firstly, reducing the time people spend in hospital, moving more recovery and rehabilitation into community settings and into people's own homes. For this, we need the expertise of social workers in the early discharge procedure. My second point is moving medical interventions out of hospital to take place in primary and community health centres where possible and closer to where people actually live. And thirdly, moving away from ever rising illness thresholds before any interventions take place. In other words, allowing illness to become an embedded chronic health deficiency, needing extensive future treatment, or waiting until the problem becomes so acute that hospitalization will be necessary with extensive post-intervention treatment. We must not allow this to happen. My fourth point is further increasing the burden on primary care with patients accessing GPs for many conditions where the symptoms may or may not be medical in nature, but in fact, most often are caused by the social determinants of health, with GPs currently acting as dispensers of medical treatment for non-medical conditions. My fifth point is understanding the close but complex relationship between mental ill health and physical ill health. My sixth point, preventing the further erosion of relationship bases for the service user or patient interaction with the health and care system. My seventh point is first stemming and then reversing the discriminatory rationing of health and care, which is causing even more widespread and more severe health inequalities, as those least capable or confident of battling through the access systems are seriously disadvantaged. And that leads to a further worsening of health, life quality and life expectancy amongst disadvantaged and vulnerable people. My eighth point is that whilst encouraging and embracing digitization, at the same time, ensuring that information technology is used in a patient-friendly way, in a way that facilitates care, rather than restricts it to the digitally literate. My ninth and penultimate point is beginning the move to further increase citizens' active involvement, improving their own well-being and health outcomes by involving them as co-producers of those well-being and health outcomes. And my 10th and final point is understanding how individuals coexist and interact with their familial group, their physical neighbors, and their communities, whether these communities and groups are physical or virtual, thereby informing us of the channels through which we may best operate if their health and well-being is to be enhanced. Well, I hope you will see from this list of just 10 problematic situations just how much social workers could contribute to their better understanding and to their ultimate solution. But to do this means that the social work profession must step up to the challenge, and that challenge is one primarily of leadership, not allowing leadership to be the historical and hierarchical preserve of the medical and clinical professions. In the remainder of this international conference, we will be seeing examples of highly imaginative and innovative thinking in bringing facets of social work into the battle. For indeed, a battle it will be, and the battle is to eradicate inequality and poverty in the recovery from COVID-19. We will be hearing about the use of art in social work as a way of reaching out to people who are otherwise difficult to reach and engage through more conventional processes. We will be gaining insights from a staff perspective into the escalating incidence and severity of violence on women. We will be informed about the situation of minority immigrant groups in transnational carer roles. Finally, we will share in a roadmap to recovery from the pandemic. I hope that such insights and innovations will both inform and inspire us to ensure that social work is a key player in leading us out of the pandemic into what has the opportunity to be a different and a better world for everyone, but especially for those less fortunate than ourselves, for whom we have a responsibility of helping in their creation of a better future for themselves and for generations to come. And I would humbly ask that let this recovery be the modern legacy of social work. Thank you.
David, thank you very much for your excellent presentation. The 10 points that you made certainly resonated with me, and I'm sure they did to many of the listeners here at the conference today. And very inspiring to the call really for social work to step up, and that last line about being our modern legacy and the role that we can play as social workers in recovery. So David, thank you very much. Florette, I wonder if I could hand over to you to ask any, if there are any questions for David in the chat. David has a few minutes he can be with us for questions. Are there any questions in the chat, Florette?
I was so enthralled by what David was saying that there's a question around PowerPoints, but that's just to let people know that they will be available. Thanks, David. Excellent. May I ask why, in your opinion, is social work at the bottom of the professional hierarchy?
Yes. It's disappointing that it is down that hierarchy, and it's because there has been a tradition that has grown up, particularly since about the 1970s and 80s, for the medical profession and indeed some of the clinical professions to take on a role that was previously occupied very successfully by social work. Some of the great innovations in social policy in not just this country, but across the world have been made by social workers. They have been the people who have challenged the status quo. They've challenged the idea of the undeserving poor and sort of concepts of that sort. They have been, in the best possible sense, disruptors of a sort of self-satisfied status quo. And I believe that they have allowed that situation to fall by the wayside. And I really, really do urge you to try and recover that situation, because social work has so much to offer that other professions cannot offer. It has a capability based on relationships that no other profession has. So I'm afraid it's allowed it to be overtaken by others. But come on, that may have happened in the past, but this is such an opportunity to recover it.
Thank you for that that answer. That question was posed by Colin Watt. We have a second question here by Jess Wagner about, she thanks you for the keynote. I agree that social workers and the profession need to be part of challenging the system to demand recovery. Students often ask how to do that on an individual basis. What do you think social workers could do to challenge both the structures of the system, but also achieve, whoops, hang on a minute here, I went too fast. Oh, I went in the wrong way. And also achieve the change on the local scale. How do you think social workers can be motivated to step up and lead in this recovery overall?
Well, thank you for that. That's a rather long and complex question. I'll do my best to answer it. I have, from my observation and involvement, enormous confidence in the young people who are coming through our educational system in social work. What I see all the time are people who have recovered that determination to change society for the better. And that's led by some inspirational teaching that I've observed too. And I think that the key thing is about self-confidence and self-belief, the belief that you have got, as social workers, such a comprehensive understanding of how individuals and how groups, how families, and how communities, and how indeed society works that no one else has. And it's the self-confidence to believe that you can challenge the status quo on that basis. And what I would do is to do everything possible to inculcate that self-belief amongst our qualifying and recently qualified social workers. Because if we can do that as the greybeards, in a sense, in this world, if we can get the Greta Thunberg type of person to come forward from the social work profession, then that is what we will do it. So it's instilling in them the confidence to challenge when they're given caseloads they can't manage, to challenge that and to fall back upon the evidence that shows quite clearly certain levels of caseloads are much more effective than others. So constantly challenge. And I think you will find that many of the people who are putting upon the social work profession the limitations, restrictions, and onerous requirements will look aghast at those challenges, and it will make them think again. So that is my answer to it. Inculcate in our young people and in our recently qualified social workers the self-confidence to challenge.
Thank you once again. And there's one last question. Thank you for your remarks, David. And this is coming from James Mulville. Does social work have an opportunity to seize the day, and this was in between quotations, to tie our social justice-oriented efforts to the struggle for ecological justice and health?
I'm not quite sure what what the question is within that. Could you explain what the question is?
Well, I think he's asking, does social work have an opportunity to seize the day to tie our social justice oriented efforts to the struggle for ecological justice and health? So I think he's basically asking, do we, I think you answered it in some ways when you answered Jess's question. What is our role at this particular time? Is this our time to really get involved, to take a bigger role? I'm assuming. Maybe James, if you want to add to that question, by all means, go ahead.
Well, thanks, Florette. Yeah, it was kind of a vague question, David. I was just, I mean, there's been a lot of work being done recently on kind of ecological approaches in social work and tying our struggle for social justice to sustainability and, you know, kind of getting away from economic growth models and towards quality of life models. So it's kind of a general open-ended question, but I'd just be curious about any thoughts you might have in that regard, especially with what's
Okay,
going
well,
on up in Glasgow these days. Thanks.
I understand that, James. I mean, one of the things I've spoken about is the social development model, which basically tries to bring together social justice, improvements in social justice, as we all want in social work, bringing it alongside economic development to show how, if you increase social justice, it actually benefits economic development. And that's the absolute key. Previously, we've been in the dichotomous situation that I referred to at the beginning of my presentation, which is between residual and institutional social policy models. With social developmental policy, we bring these two things together. Now, I won't really comment on the ecological thing, not because it's not well worthwhile, but I suppose it's about challenging what I believe we can challenge successfully. And what I think we can challenge successfully is to demonstrate how, if we bring more and more people who are currently marginalized in society into the mainstream of society, how not only society itself and the equity and the values of society will be improved, because we know that, but actually how the economy will be improved as well. And that, I think, should be the main thrust of what we do, James, on this. I'm going to have to excuse myself now, if you don't mind, because I have to dash to get a train. So I'm afraid that's the last question I can take. So thank you all very much for the invitation today. I deeply appreciate it. And can I wish you all the best for the rest of the conference?
Thank you so much, David. And
Thank
thank
you.
you, Florette, for the questions and for those asking the questions. Thank you very much, David, and have a safe journey. So I said earlier that there would be some further welcoming comments from each of the universities. So whilst I offered welcome on behalf of the organising committee, I would now like to offer a welcome on behalf of Birmingham City University in the UK. Birmingham City University is currently celebrating its 50 years of social work education, albeit that we are 1 year late. There was a delay because of the restrictions of the pandemic. And through a series of events, both online and in person, we're reflecting on the work of the university, which, in partnership with employers, with practitioners and with experts by experience, has educated and equipped pre- and post-qualifying social workers to make a difference and transform people's lives. And I would encourage everybody to have a look online at our range of events celebrating 50 years. Over the last 18 months, I've been inspired by our students who have demonstrated creativity, flexibility, resilience, and competence in supporting vulnerable people during the pandemic. And I have every confidence that they will be an asset to our nation's recovery from the pandemic. I encourage them to be bold in showing leadership in the way that David Croisdale Appleby has advocated, such that we don't only build back, but that we build back better. But I recognise that this is no easy challenge. In its 2020-21 State of Healthcare and Adult Social Care in England report, the Care Quality Commission highlights not only the impact of the pandemic on the health and social care service users, but also on its staff, highlighting inequalities and placing immense pressure on an already stretched workforce. In the UK, the current Prime Minister, promised to fix social care once and for all on his first day in office. And in September this year, the government presented to Parliament its plan for doing so. And this plan was titled Building Back Better. This is a term that's been adopted in other documents and is the title for this conference. But it's important that it is more than simply a slogan. The government's plan has been welcomed as a step in the right direction, but it's been critiqued for being far from a solution to fix social care. Indeed, recent research from York University demonstrates that cuts to local authorities over the past decade, with more still to come, has affected an already stretched service, and that has affected the vulnerable people and those living in poverty with whom social workers work. But I think we would all acknowledge that fixing social care and having it as a system that will build us through this recovery requires more than money. The CQC in its report calls for a future focused on outcomes on people, for transformational change, and to build back something better, not just go back to what we had. Last month, a 2021 study by McFadden and colleagues showed that whilst the pandemic had an impact on the mental well-being and quality of working life for social workers, their quality of work life and mental well-being was significantly higher and significantly better in 2020 at the height of the pandemic than they had actually been in 2018. And I think this shows how quickly the social work workforce increased its support and did rise to the challenge. And as a profession that is centered on people, a profession that offers hope to people, I am convinced that social workers can lead the recovery from this pandemic and help us build back better. So welcome from Birmingham City University, and whilst we've been through such a difficult 18 months, I do hope you'll join our celebrations of 50 years. But I'd like now to hand over to Dr. Michael Yellowbird to say welcome from the University of Manitoba, followed by Florette Guiesson with words of welcome from the University de St. Boniface. Michael, over to you. Thank you.
Thank you, Peter. Good morning, everyone. And I want to say in my language, did you wake on ho, dish to do, no do wagon on the wensagadich, So in my language, I offer everyone greetings and good health and hope and happiness for all of you and your communities and your family. I'm coming to you from Treaty 1 territory in Winnipeg, Manitoba, the homelands of the Dakota, the Ojibwe, the Dene, the Cree, Ojai-Cree, and from the homelands and home territory of the Métis people. It's a pleasure for me to be here this morning to offer remarks on behalf of the University of Manitoba, who are participating in this really important conference about recovery after the pandemic. Our faculty of social work is engaged in working towards a world where there are no great inequalities of wealth or income. We understand that where there's economic and political power that is more evenly distributed, that we thrive and we do much better. And this is sort of the theme that we've been latched onto since the pandemic, is to ensure that economic and political power is evenly distributed among all Indigenous people and settlers in the province of Manitoba. We understand where human need is central. The value of distribution of society's resources is of utmost importance. And this has become very apparent to us during the pandemic, where we've seen high rates of disparities among Indigenous people and non-Indigenous people in regard to the COVID infections and how people are doing under this current pandemic that has not ended by any means. We as a faculty are engaged in the celebration of the diversity of cultures, and we are engaged with our students during this pandemic, and if the pandemic shifts soon, of course, so people have greater control over their own lives and their communities and their culture. We are engaged, our students are engaged in efforts to where all people who are afforded maximum opportunities to enrich their physical, spiritual, and psychological and intellectual well-being is of utmost importance to us. I want to offer these short remarks and also just a thank you for inviting me to give these opening remarks. And again, I want to acknowledge the wonderful speakers that are here that are going to be giving their remarks today. And of course, I want to, on behalf of the Indigenous people and the settler allies and settlers of this particular part of the world, I want to welcome each and every one of you to the International Conference on Building Back Better. It's not just a slogan: innovations in social work practice, policy, and education to eradicate inequality and poverty and the COVID-19 recovery. And the theme of this conference and the topics that will be discussed are critically important information for all of us in the social work world. And there's an illustrious group of presenters that will be sharing their thoughts, research, and passions of what it will take to build back even better following the COVID-19 pandemic. I want to end my remarks by thanking all of you who are involved in organizing this conference, and a special note to my friend and colleague, Dr. Sid Frankel, who asked me to give these introductory remarks, and all of you that are participating. Thank you, and I really appreciate this time to give these remarks, and I hope you have a wonderful conference. I'm going to turn it over to the next speaker. Florette.
Thank you very much. On behalf of l'Université de Saint-Boniface in Winnipeg, I thank you for giving me this opportunity to provide the welcoming remarks on behalf of our university. Like Dr. Yellowbird, we are also located on Treaty Number 1 land, the land of the Anishinaabe, the Cree, the Ojibwe, the Dakota, the Dene, and also the homeland of the Métis Nation. As I was listening to the keynote address, what really struck me as very important in our world of social work is the notion of leadership. It's the notion of us taking our place in the social justice area in order to be able to reduce the inequalities, in order to be able to make things a lot better for the vulnerable people, and to reduce that gap between the have and those that have not. As I listen to, as I look at the impact that the COVID has had on people's mental health, I really recognize that the government has, our government of Canada has been, for the first time, looking at creating a portfolio and a new minister dealing with our dependency as well as our mental health area here in Canada. So that was a really big plus for the world of mental health and bringing more well-being for our people. When I also look at what has been happening in the past 2 years, like what Peter has said and like what Michael has said, I have noticed an incredible resiliency amongst our students, amongst the ability to be able to do the work in these very difficult times and wanting to be there, wanting to be involved, wanting to make a difference. So when I'm looking at building back better, I think this, as hard as the COVID-19 pandemic has been on all of our people and on students and just the general public as a whole, I think what I see is that we have learned, and hopefully we are going to use some of the new innovative practices in a way that will be not temporary, but that will be more permanent within our social policies, our way of working, our way of intervening, and our way of interacting with people. Alors, dans mon langage, in my language, I'm going to speak in French a little bit at this point. Alors, j'aimerais vous accueillir chaleureusement à cette conférence sur les pratiques innovatives pour reconstruire et rebâtir un monde meilleur, un monde sans inéquité où la pauvreté est beaucoup plus réduite. Alors, bienvenue et j'espère que vous allez apprécier et vraiment profiter des différents conférenciers, conférencières lors de cette conférence. So I really would like to wish you the best during this conference. I think in working with this wonderful team of organizers, Birmingham University, City University, as well as Université of Manitoba, we have really looked at providing a real full gamut of conference presenters. So we're looking at people that are coming from academia. We're looking at people who work in organizations on the field. And we're also looking at people who provide a lot of services for the people that we are trying to help and to eradicate inequalities in their world. So by all means, write your questions in the chat and we'll try to get to them as much as we can, and have a great time. Thank you.
Thank you very much, Michael and Florette, for your kind words of welcome. Just before I hand over to the first speaker, I just want to highlight the book that was published that explored social work and social work's role during COVID-19, Lessons for Education and Practice, edited by Denise Turner. And I'm delighted to say that the publisher, Critical Publishing, is offering a 25% discount on this book for all those attending the conference today. And details on that voucher in order to get the 25% discount, should you wish to purchase the book, the details are made available in the Eventbrite reminder link about the conference that will have been sent to you. So huge thanks to Critical Publishing for publishing this work and for offering such a generous discount to our delegates today. But now I'm delighted to welcome the first of our speakers, David Collins. Over to you, David. We look forward to hearing your presentation.
Thank you, Peter. Right. Thank you, David. Right. Let's see if I can get this working. Just trying to advance the slides. Aha, right, okay. Well, hello everybody, my name's David Collins. I'm a senior lecturer in social work at Birmingham City University. I'm also undertaking a professional doctorate in education, an EdD, and my research interest is in using art-informed approaches in social work practice education. In this presentation, I will comment on a few examples of the importance of art during the pandemic and the relation of art to social work, and include some personal responses both to art and to the pandemic, and discuss the potential of art to complement an emancipatory social work practice. The first image the first two images, in fact, were done by my granddaughters, and I think when the pandemic first entered Europe, the first place to be seriously impacted upon it was Italy, and particularly in the Lombardy region, suddenly, with social distancing going on, suddenly lots of drawings, paintings was appearing in people's windows, on balconies, often with the term "andrà tutto bene," which it means it will be fine. And the rainbow was often used as a symbol of hope after the storm. So, and I know when I'm walking around the village where I live during the pandemic, so many people's windows are full of pictures, particularly of rainbows. They were turning their houses into galleries and leading to what some people have called the democratization of the gallery space. So there was an outpouring of art and creativity during the pandemic, particularly through the internet and social media, online art forums, art choirs, art poetry sessions, singing on balconies, cooking, baking, all at a time when the arts organizations and practitioners have been decimated by social isolation. So, you know, was there a shift in culture? Popular opinion previously maintained that art requires a certain level of cultural capital, art or culture being synonymous with perhaps pretentious art exhibitions or even incomprehensible operas. Could this have shifted? Could this have changed to something more accessible, helping bridge the divide between the so-called high and low perceptions of culture? Sorry. And if anybody's wondering about what this little squiggle is underneath the rainbow and above, those are rainbows. Sorry, those are butterflies. A number of notable artists were busy during the pandemic. I was going to put a lot of more images into the PowerPoint, but I was a bit concerned about copywriting. So I've put some links here that when you do get the copy of the PowerPoint, you'll be able to, if you're interested, you'll be able to kind of link and find out a bit more. But Ai Weiwei, as you may know, the Chinese dissident artist and activist, produced a number of masks, originally printed using lino cuts, and he sold 22,000 of them through eBay in the first month to people in 70 countries, raising $1.4 for COVID humanitarian emergency projects. Banksy donated a canvas called Game Changer to Southampton Hospital as a thank you to key workers. This depicts a child playing with a toy nurse, having chosen the toy over superheroes, Batman and Spider-Man, which sold for 19.5 million UK pounds, and the proceeds were given to the hospital. So a couple of examples are really of perhaps using some of the absurdity of the art market for altruistic aims. I love street art, murals on buildings, and I just want to mention one about a black Manchester United and England footballer called Marcus Rashford, who has become quite a household name, not just because of his prowess as a soccer player, but because of his campaigning for food poverty and child hunger. He was brought up in a very poor family in Manchester and personally experienced child hunger when he was a child. The painting was painting in a place called Withering in Manchester, near to where he was brought up. But unfortunately, Marcus missed a penalty in the Euro 2020 Cup final, as well as two other black players. And there was just an absolute torrent of racist abuse online and otherwise following that. And the mural was defaced. Slogans was scrawled on it and indecent images. Police, interestingly, said the vandalism was not believed to be linked to racist nature. But there was such an outpouring of support, really, and lots of kind of images was stuck on the mural, particularly covering up some of the obscenities. And Marcus tweeted that the communities that wrapped their arms around me continue to hold me up. I can critique my performance all day long, but I will never apologize for who I am or where I come from. Many examples of the use of art during the pandemic. These are just a few that you might want to link on and find out a bit. I mean, Sean Leonardo, for example, used performances in prisons in the USA to argue for prison reform as coronavirus has devastated prison communities. Art and activism, many media activists in Brazil, Peru, South Sudan and elsewhere have showed public health information in the form of comics, video or cartoons. And Pablo Helquera set up a free singing telegram service delivered via Zoom to increase connections and respond to loneliness and grief. What did I do during lockdown? Well, rather curiously, I found myself kind of doing some paintings based on some sketches I did 40 years ago on a trip to south of France. And for those French speakers amongst you, I do apologise for my pronunciation to start with, but this is a Mont Sainte-Victoire, near Aix-en-Provence in France, made famous by Paul Cézanne. And if I can flick on, this is a Boats of Grimaud. I found myself using quite exuberant colour and paint marks, and I think it was probably an expression of a good to be alive feeling, really. This is the Bay of Saint-Tropez from the village of Grimaud itself, and this isn't quite so old. It's about 20 years ago. Some sketches I did around a place called Blackstone in near a village in Worcestershire, UK, called Bewdley. And I think it was a way of actually addressing some of my fears and anxieties, being disorientated by being disconnected from people and familiar routines. I think it was a response to feeling restricted by, especially during the lockdown periods, wanted to go back to a safer, happier time or place, and perhaps a form of escapism. So what can art do? Well, it can express emotions and feelings, channel our creativity, it can lift mood, stimulate curiosity, help us to appreciate people and our environment. It can express our individuality and identity. It can express community identity, challenging existing beliefs, ways of thinking, ways of valuing, makes connections outside of the normative. It can help us to deconstruct and reconstruct our understanding of reality. And it can help us to develop our social and cultural capital. And Pierre Bourdieu, the French sociologist and philosopher, maintained that it is possible to be economically poor, but socially and culturally rich. Art has been used increasingly in research, and here are just a few examples. I follow a social work academic called Efrat Huss, who's actually from the University Ben Gurion University in Israel, who uses lots of art in research. I think it was a particular study that she did with some colleagues around food insecurity and hunger amongst Israeli Bedouin children, where the children was encouraged to draw as part of the data collection process. And the drawings were then later exhibited to promote public awareness. This was an interesting study where the participants was a group of social workers working in a war situation, where they were encouraged to draw pictures about the things that they were stressed about, their fears and anxieties, and they were then later asked to return to do some more drawings based on those as a way of taking control and how to manage their emotional resilience. And more recently, let's flick this on. And more recently, been involved in online CB art, a kind of combination of art and CBT, as an intervention in COVID-19. Again, where drawings and paintings have been used to explore people's stress and anxieties and coping strategies and resources. But it doesn't have to be formally therapeutic. I think there's a therapeutic quality to art. I mean, I've found it extremely valuable in the past. I would often return from work and do some paintings, really, of some of the people that I've been working with. I mean, this is, for example, this is Ernest. I've changed names for confidentiality reasons, but even though Ernest has long since passed, he was in his 80s when I first met him as a social worker. He was originally from the Caribbean, came to Britain when he was about 7 years old. He'd been widowed for 2 years. He'd got dementia, and I think his wife had really masked the level of dementia that he had. It was an evolving door situation. He was getting anxious at home, getting admitted to hospital, then being discharged back home, lasting 1 or 2 days at home, and then back into hospital. I managed to break that cycle for him by setting up a befriending service and some support at home. This is a family of refugees who were from the Middle East, who were placed in quite squalid private rental accommodation in Birmingham, and were subject to racist attacks and abuse, which is, you know, just thinking about it, what they've experienced in their own country and coming to what they think was a safe country, and their experience was quite appalling. I worked very much with a racial attacks monitoring unit, and I had to really challenge the police, really, because of their inaction, managed to get them rehoused to a more multicultural community where they were a lot safer. And this is Katrina. She was born in Austria. Again, she was 80s when in her 80s when I met her. She was conscripted by the Nazis into the nursing profession in Austria, but later met a UK serviceman and came to the UK. I really admired her spirit, actually. She was a homeowner, and they were going to demolish the whole street for so-called improvements, and hers was the last house standing. She actually refused to move. So these kind of paintings for me was a kind of reflection, some way of actually getting in contact with the effective relationship, the kind of emotional release, and a celebration of some of the people I've been working with as unique beings. I must say that I never shared these paintings with the people I did them about. They may well have been quite horrified if I did. But the use of art is not a new thing. A British kind of academic, Hugh England, wrote a book back in 1986 called Social Workers' Art. And he mounted a spirited defense of the creative, intuitive, and self-expression, expressive notions of social work practice against a rising tide of neoliberalism, proceduralism, and managerialism. And he posed this question: can the arts offer a paradigm for knowledge and practice in social work? And I think that question is more important than ever as we work in a climate where neoliberalism and free market economics appears as normative, and we work against the undercurrent of public sector cuts by central government, where creativity is ill-defined and more related to managerialist mantra, doing more with less. I think there is a significant issue in social work, and the threat of neoliberalism and managerialism to the profession's aspirations of promoting social change, social cohesion, the need for collectivization, and the empowerment and liberation of people, as stated in the global definition of social work by the International Federation of Social Workers. Schubert and Gray, 2015, wrote a rather provocative article called "The Death of the Emancipatory Social Workers' Art and the Birth of Socially Engaged Art Practice." So that working in codified, prescriptive, bureaucratic systems encountered by many social workers, this has the impact of diminishing the effect of their creative potential. But despite this, social workers continue to be creative and empower those they support to be creative with little resources and sometimes hostile situations. I think there is a golden thread really that runs through, and it's certainly a link or even a symbiosis between radical and critical social work practice, socially engaged and politicized arts, and post-research practice. I mean, Cole Kim, 2007, I kind of drew the link there between these practices, social work and the arts and post-research, can be provocative. They can trouble, antagonize, frustrate, agitate, and subvert dominant social structures and power differentials. They engage us in multifaceted perspectives, the use of visual, verbal, and written metaphor to engage us in issues that are not easily quantifiable or understood. And they provide opportunities for different interpretations, multiple readings, rich dialogues and debates suited to social and political discourses. So at times a great and profound change presented by the pandemic, and also I think issues like Black Lives Matters and the global environmental crisis. And I think art can help us in our journey to resist structural inequality and oppression, and hopefully can help us to reinvigorate the social work profession.
2 minutes left, David.
Thank you, Peter. Just concluding. So there is much in common between critical social work and critical art practice. At a time when political and economic hegemonies strive to re-establish themselves as slogans such as "Build Back Better" that are mainly aimed at those responsive to populist politics, the arts can complement our attempt to resist the restoration of political and social structures that support inequality and help us in the emancipatory ambitions of social work. I advocate for increased use of the creative arts in both social work education and practice, and this relationship can even become the pièce de résistance of the social work profession. So thank you very much. If obviously we'll take a few questions there, but if anybody got any thoughts or questions they don't ask today, then here's my email address. Thank you very much.
David, thank you very much for an excellent presentation. I'm always, I've been lucky enough to hear you speak before, and I'm always fascinated and enjoy seeing all your own artwork, as well as hearing about the role that artwork can play in practice. I certainly have a question that I'm going to post in the chat, but please, if there are any other questions, put them in the chat, and I'll hand over to Florette to read those questions out to you, David. Thank you.
Thank you very much, David. I really appreciated hearing a lot more about the connections between art and social justice and social change. Peter's question just came up, and he says, do you think social work bodies such as the regulator Social Work England and Social Work Association could do more to promote the use of art in social work practice, particularly in response to therapeutic needs people may have post-pandemic?
Thank you, Peter. Great question. The quick answer to that is yes. It was interesting that when I was doing my review of literature for my research, there is virtually no mention at all in any of the in the UK anyway, in terms of standards, professional standards, guidelines. We have something called the Professional Capabilities Framework. there's very little mention about art at all. There's mention about creativity at times, but it's very brief. It's not very specific. It doesn't really explain what creativity might be. So I actually think that, you know, I think as a profession, I don't think it's just a niche thing. I think we are all inherently creative. We may find myriad of ways of actually finding ways of expressing ourselves and our creativity. I think the important thing for me is about using creativity as social workers to actually empower some of the citizens that we work with that are in need of our support, and how can they be creative, you know. So yeah, I think regulators could do a lot more to promote it.
Wonderful. Thank you, David. I didn't put this in the chat, but one thing that comes to mind is as you're using art in research, how do you go beyond, or how do you deal with the stress of your participants, the stress around producing something artistic or creative that the researcher is asking for? How do you go beyond that? How do you help the participants to deal with that?
Well, interestingly, I've done a pilot study. I'm yet to do the main study, but in the pilot study, I run a workshop. And in this case, in this particular workshop, it was actually practice educators involved in it. So we spent time and some exercises unpicking what people's concepts of art is, what it meant to them personally, and what some of their anxieties was about. And very trying to reassure people that, you know, whatever they did produce, which could be part of the data collection process, wasn't going to be judged, you know, artistically. This was about self-expression. And I've done activities with students in the university and got them drawing and things like that. And I've always made it quite clear that, you know, kind of artistic skill isn't necessary to be able to express oneself in certain ways. So I think the workshop has really helped to actually kind of tackle some anxiety, because I think some people naturally think at the beginning, oh, I'm not artistic, you know. People will make fun of what I've done, you know, but very important that we reassure people that's not the case.
So you need to set the table way before you do your research project then.
Yes, very much so.
Absolutely. Well, that is, Colin mentions that he loves your final image, and I tend to agree with Peter and Colin that your paintings were just spectacular. So thank you for sharing a piece of yourself with us this morning.
You're welcome. Thank you.
Back to you, Peter.
Thank you, Florette, and thank you, David, for an excellent presentation. Not only is it a joy to listen to you, but it's a joy to see your work. And you've inspired us all, I think, David, to explore art in our own work and to be brave enough to give it a go in the safe knowledge that we won't be judged on our abilities. So now I'm delighted to hand over to our next speaker. A number of people have been involved in the project here, but I'm delighted that Karen Crow is going to be speaking to us about the impact of COVID-19 on women's experience in accessing violence against women services. So Karen, we're delighted to hear from you next. Thank you.
Great. Thank you so much. Just want to make sure everyone can hear me. Sometimes I have mic issues. Can you all hear me?
I can.
Great.
I think we can hear you.
Okay, perfect. Thank you.
Yeah, no problems, Karen.
Just wanted to be sure before I move forward. Okay. Well, thank you, everyone. As Peter said, my name is Karen Crow, and I'm going to be speaking to you today about a research project. The title that Peter read, The Impact of the COVID-19 Pandemic on Women's Experiences Accessing VAW Services, and listed next to my name are the other people who participated in this research project. So first, I'll start with an overview of my presentation. I'll start with an introduction of my role and then also the program, the Violence Against Women program this project is about. We'll talk about the research questions, the rationale for us doing this research project, the demographics of those who participated in the study, the results, and then key takeaways, thinking about the theme of building back better that we learned from this project. So I am a manager at an organization called Family Service Toronto, which is a large social services agency in Toronto, Ontario. And this research project was based in our organization's Violence Against Women counseling program. And this program provides counseling services to women-identified people who have experienced violence, which includes intimate partner violence and gender-based violence. I do want to acknowledge that violence exists across genders and communities, but our program and the research for this project focuses on violence against women. So now we will talk about the research questions. We were hoping to learn about two things during the course of this research project. One, the perspectives that staff had on the impact that COVID-19 had on our clients' experiences accessing counseling and other services. And two, how remote work impact counseling, the counseling process and counseling practices. And the reason we decided to do this study is that there was research and reports in the news that there was an increase in gender-based violence, intimate partner violence during the pandemic, and there were concerns about the safety of those living in violent situations. So we wanted to talk to staff about their experiences and get an understanding of their perspectives of client experience. So I will briefly go over the methods for this study. It was a cross-sectional observational study. We received full ethics approval from our internal ethics board. Semi-structured interviews were conducted with our Violence Against Women program staff, and this was done virtually or over the phone. And then the information collected in those interviews was we conducted a qualitative content analysis to learn about themes and key takeaways from those interviews. And then I'll briefly talk about the demographics of those who participated in the study. So 9 staff participated, a wide range of ages and a wide range of experience providing violence against women counseling. There were also, just something of note, I think, is that our staff in the program speak 12 languages. So they work with a really diverse population, especially we work with a lot of women who are immigrants or newcomers to Canada. And some of the languages staff speak are listed in the PowerPoint slide. So now we will go to the study results. And a couple of things I want to mention before we discuss the results. One, this was not a quantitative study and we only involved our staff. So the reports and assumptions are from staff's perspectives and also are only based on the experience of the clients who accessed Family Service Toronto or FST services during this time. And then I do also just want to say I'm going to be discussing gender-based violence and intimate partner violence. So please just do what you need to do to take care of yourselves as I go through this presentation. So to start, we will discuss the impact of COVID-19 on the clients we worked with. Then we will discuss the impact on staff, and then I will discuss the key learnings and takeaways. So to start, we asked staff about their general impressions of the impact of COVID-19 on violence against women. And some themes emerged that are listed here, and this is in a circle, but it should just be arrows pointing to one another because all of these things I think are interrelated and had an impact on one another as well. And I think what staff found was that COVID-19 had a significant impact on clients, especially thinking about people losing their social outlets. And that means both formal, so services they might have accessed, and also informal social support. So the ability to go to a neighbor's house or go see a family member very quickly and easily. Also, something that stuck out to staff was because people were stuck at home, sometimes in abusive situations, that led to increased power and control by the person who might have been abusing our clients, and increased vulnerability, being stuck at home and not having access and contact with the outside world. Also, something that staff noted was that there was an increase in the trauma and fear experienced by our clients. And also clients experienced a lot of re-traumatization. People who might have experienced control and power before in an abusive situation were then stuck at home because of lockdown measures, and people found that stressful. Also, some of our clients reported that they found wearing masks to be really challenging for them and re-traumatizing. So additionally, we asked staff about abuse and what abuse looked like during the pandemic for their clients. Staff reported that overall there was an increase in abuse reported by clients, but there were also changes in how abuse looked during the course of the pandemic. One type of abuse that really stuck out to staff was financial abuse. Many of the women we worked with lost their jobs during the pandemic because their jobs went away because of the lockdown measures. And so this led to an increase in financial dependency on people who might be abusing them. Also, women lost access to outside information or resources because they were stuck at home and maybe didn't have access to technology. And so the people who were abusing them had control over the information that they had about what was happening in the pandemic. Another type of abuse reported as being common was emotional abuse related to child custody. So partners might not follow social distancing guidelines intentionally, and then that could put the woman and her children at risk. And then I mentioned this a little bit already, but access to phone and technology, which was really important during the pandemic. Some clients had the abusive person in their life take control over their phone or their computer and not allow them to have that as access to either for social reasons or also just access to information. So overall abuse increased, but again, some of the ways that it looked were different. We also asked staff about their perceptions of why the abuse might have escalated during the pandemic. And this chart here shows some of the reasons that staff thought might be reasons why. I think overall, for all people, there was an increased level of stress. And a big piece of that was, again, lack of access to social outlets, also lack of access to services that people might have accessed before. And I think this was for both the women that we worked with, but also for the people who were abusing them. If they had good social supports before, those went away, which could increase abuse. There was also an increased burden of work that fell on women, because they might have to be home with children. There was less ability for them to go out and do things on their own or potentially access services. They might also have other caregiving responsibilities. Some women had to leave their jobs. So these things also contributed them to being home more potentially and in closer proximity to the person abusing them. Also, poverty is listed here, and staff assumed that poverty or financial stress was another contributor to potential escalating violence. So that was a high-level overview of what staff reported about clients. Now I'm going to talk about, now we'll talk about the services that clients and their ability to access services during the pandemic. So staff felt that additionally, there was an increase in violence. There was also increased challenge in clients accessing services. And 3 services that were discussed during the research project. One was our own counseling services. One was legal services, and the last was other services, like listed here would be shelters and food banks are 2 examples of the other kinds of services. And I think overall, it was harder for people to access services. And I think something of note was that legal services was named by our staff the most frequently as the service that was hardest to access during the pandemic. Courts were closed at the beginning of the pandemic, so there was a delay in cases being processed, and so many women were in limbo waiting for their cases to be heard. We also had clients saying that it was very hard to get information about what was happening in court, and so it was a really, really big source of stress for the people we work with. When it comes to counseling, what was reported is that women had a real difficult time accessing services if they were living in an abusive situation because they were afraid that the person they were living with might overhear what they're discussing with their counselor, and they didn't have a safe place to access counseling. So they had to figure out creative ways to access counseling with living in an abusive situation. And then for other services, what was reported is it was challenging for people to access services that might typically be in person because of fears related to contracting COVID-19. So for example, as listed here, shelters or food banks. So we also asked staff what they thought were factors that impacted clients' ability to access services. So we know they had challenges in accessing services, and why was that? And there were 3 themes that emerged from that question. And what I've listed here, so there's the factors that staff perceived as impacting clients' ability to access services, and then there are some quotes directly from the participants in the research project. So the 3 concerns that were, or themes that emerged, one was access to technology. And you can see from the quotes here, one, there was a lack of access to technology, also a lack of knowledge of technology for some people. Also, as we discussed previously, there might have been control over women's technological devices, and so they didn't have access to them for that reason. There were also safety concerns discussed. Women were in a really difficult decision because they were forced to choose between living in an abusive situation or potentially leaving that situation, but being anxious about getting COVID-19. For example, if they decided to go to a shelter, which was a shared living space. They also had to make the decision, am I going to call for help with my abuser home, knowing that could potentially escalate violence? The last thing that staff reported related to clients' ability to access service was there was less opportunity for outreach to people who might be isolated. So if you look at one of the quotes from a participant, it says, I see a lot of immigrants, refugees sponsored by partners. The issue for them is not knowing their rights and services. The partner controls them and they don't know where to get services. So there are often ways in the community that people can learn about services and supports, and those were taken away when people were stuck at home. And so it exacerbated already barriers that people who had previous barriers to accessing services, it exacerbated that, it made it even more challenging. So that was a lot of information about staff perception about clients. The next section, I'm going to talk a little bit about the impact of COVID-19 on the VAW counseling staff. So we talked to counselors about their own experiences, and they reported there were significant changes in the way that they work. So we went from being pretty much fully in person to being fully remote. And some of the challenges that they reported are listed here. I think a big challenge was just moving from doing in-person counseling and therapy to being remote. It changed the way that you build trust. It also impacted the types of modalities that people could use, especially if people were using a specific modality they felt comfortable doing in person. Having to shift that virtually was a challenge. We discussed safety issues for clients. There were also new safety questions that arose for counselors. Things like, if I schedule a Zoom session with a client, how do I know that no one is listening to that Zoom session? Or if I send an email with information that might be important for someone's safety, how do I know that someone's not accessing that? So it brought new questions to the service about staff safety. Also, there was an increase in flexibility because we were working remotely, but that kind of blurred the boundaries between work and home for people, which is something I think a lot of us experienced during the pandemic. And then lastly, the way we worked fully changed. So our administrative processes changed. So staff had to learn new administrative procedures. So those were challenges. There were also a lot of learnings from this experience of going from being pretty much fully in person to working fully remotely. And so this slide lists some of those learnings that we had during this time. I think some of the key takeaways are, one, staff really learned to focus on the information they had in order to provide counseling services over the phone. So listening to the person's voice, their breathing, their tone, and also thinking about what counseling modalities and figuring out what counseling modalities felt effective to them over the phone. Something staff also reported is that providing service in multiple modalities, which we were able to do remotely, was really helpful. So we offered phone, Zoom, Zoom individual sessions, Zoom group sessions, and webinars. And specifically with webinars, people could participate and no one could see the other participants. So there was a level of privacy that many of our clients felt comfortable joining a webinar, whereas they might not feel comfortable joining a group if they didn't want to be seen online. And then the last bullet here talks about a pilot project that we did throughout for about a year during the pandemic. And this was where a provincial line that provided crisis services to women who've experienced violence, they would identify clients they felt were high risk and also who were looking for counseling, and they would refer them to Family Services Toronto directly. And they would immediately be scheduled to meet with a counselor within 5 to 7 days. And our counselors or the staff in this study found it was helpful to provide immediate support to women at a critical time, like when they were calling a crisis hotline, rather than potentially having them wait for service, because oftentimes there's a high demand, so people do have to wait. And the women who were in this situation were often women who were considering going to shelter or leaving an abusive situation. So a really critical decision-making point in their lives. We also talked to staff about what was helpful for them in supporting their well-being during the pandemic. And some of the things reported are listed here. But I think the big theme of this is that just more opportunities for interaction, because there's not those informal interactions that happen in the office. And also just, they did like the increased flexibility of the workday and the work schedule. And so we increased our team meetings, we had more. We also increased opportunities just for staff without management to get together and discuss their experiences. So I have just a couple more slides, but as I go through these slides, I'm getting to the more solutions-oriented, the Build Back Better part of the presentation. And I did want to invite all of you, if you have any ideas after listening to kind of what we learned from this project, if you have ideas for how to build back better, I invite you to put those in the chat, and we will discuss them after I go through 2 more slides. So put any ideas you have about how to build back better related to violence against women counseling in the chat. So we did ask staff this question: what are suggestions you have for how to move forward? And they had there were 4 kind of, again, themes that emerged from talking to staff. They were really great ideas. One is virtual service, continuing that, so offering a hybrid model to increase accessibility. Another, and this comes from what I talked about related to, there was a challenge getting information to women who might not already know that services exist, improving our organization's outreach via social media. The third was funding, trying to get more money to support programs for women who've experienced violence, knowing that coming out of the pandemic, there were many people who couldn't access services. And then the last was partnerships. So what are some, like thinking about how to coordinate services? Women who experience violence, there's a lot going on. They might be in legal proceedings, they might need some financial support. They also might need mental health support. So how do we better coordinate all of the services that people might need was another suggestion that staff had. So building better partnerships with other organizations. And then I'll review the key takeaways, or some of the key takeaways. There were many, but these are some of the key findings we felt from the study. 1, violence was perceived to escalate during the pandemic. 2, there were many factors, but some that were mentioned by staff were poverty, job loss, and social isolation, which were perceived to exacerbate issues related to intimate partner violence. 3, the most vulnerable clients, and these include racialized women, immigrant women, face the most barriers to accessing services and supports during the pandemic. And then the final takeaway is that there are benefits to a flexible hybrid counseling model. So hoping to be able to continue to work in that way moving forward. So now the question is, from all of this, is how to build back better. So I'm looking, or I don't know if anyone made any comments in the chat. If not, it's totally okay.
Thank you, Karen. That was excellent. There are a few comments in the chat because, well, I know there's one because I put one in. It was very interesting talk, and I was very interested in hearing the different aspects from those accessing the services, but very interested actually in the experiences of the counsellors themselves. So, Florette, I'm just going to hand over to you if you could read out the comments in the chat and invite Karen to respond. Thank you very much for an interesting presentation, Karen.
Yeah. Thank you, Karen. Very interesting. I have 2 questions here. and one is from Peter. I was interested in hearing about the strategies counselors used when you remote working. I'm afraid this is a question rather than a suggestion. Will you or do you now maintain some of these new ways of working? For example, even when face-to-face is possible again, will you continue to offer counseling suggestions via Zoom phone? You mentioned the possibility of a hybrid model.
Yeah, so we've had discussions about counseling practices that we feel are beneficial, but we haven't been recording them or writing them down or anything like that. So I think that's a really, really great idea. And I guess our plan moving forward will be when people call in to ask for service is to check with them about what kind of service they want and then to kind of assign them a counselor based on that. And before, I know there might be a couple of questions, but I did want to I have one extra slide I just wanted to go over briefly related to how to build back better, and listed here are just some ideas. I know I talked about the counselor suggestion, but just some other ideas that we thought of related to this. One, the increased flexibility, giving clients choice in how service looks for them and what works for them. A huge piece that came out from this was addressing technology gaps. So I think both at the organizational level, making sure staff feel comfortable with technology, and then also with our clients, getting technology to clients. Increasing education outside of our sector so that people know that the services and supports exist and people are better educated about gender-based violence. And then also, as I discussed previously, coordinated partnerships to better support women. So, and I did want to just put up, thank you all for listening to this presentation. Welcome questions now. And this is my contact information and also the contact information of Maria, who was the head of the development of this research project. So you can email us if you have questions or would like to see the report in more detail.
Okay, thank you, Karen, for those final remarks. Dave Nichols has put a few links that you wanted to share, Karen, in the chat, so you can take a look at that. There's also another question from Jess Wagner, who thanks you for your presentation and mentions that there's lots of similarities in the challenges faced by women between UK and Canada. How quickly were services able to adapt to the changes? Did you find an overall difference in people engaging more or less online, virtually, as opposed to what it may have been if services had continued to run face-to-face? And this is apart from the webinars.
So our organization was very lucky in that all staff already had laptops, or for the most part, I think some people had to get laptops, but we had kind of the infrastructure set up where we were able to not pause service. So we continued with service. I know that that was not the case with other organizations where maybe their staff who were working remotely didn't have access to that technology in the same way. So for us, we were very lucky in that we were able to continue service completely and just move it to being remote. And as far as finding a difference in people engaging, the demand for service was perceived, though we don't have quantitative data, it was actually perceived to increase during the pandemic, which is interesting. But yeah, overall, I think we had a higher volume of calls. And for example, I talked about we had a partnership with a crisis hotline. I know they were having the highest number of calls they had ever had throughout periods of the pandemic. So we don't have a comparison because like during the pandemic, most things were remote, but we definitely felt like there was an increase overall of people accessing services.
Okay, we do have a few suggestions for you, Karen. Colin Watt mentions that to build back better, should we be training social work students, social workers, counselors in IT skills? So that may be a question that you may want to kind of ponder upon. And David Alper says, you spoke of working with the most vulnerable women. Suggestions together. Do you identify the ways in which institutions marginalize, minimize, and discredit the experiences of racialized and Indigenous people? Do you encourage your participants to identify how their culture and history can be sources of strength and inspiration?
Thank you. Those are both really great questions that I will
And Dave kind of says the links are not for Karen Crow's presentation, so I guess I misread that. Okay. Oh, it's Karen Schro. Do we have a
Hey,
Karen?
no, sorry, that was also a mistake on my part. I was hastily typing and I got mildly disorganized. They're actually for our next presentation after the break.
Oh, so they're for Shelley Wattenberg.
Yes, they are.
Thank you.
Okay, thank you, Dave, for the clarification. Thank you very much.
Thank you,
And that's it for the
Florette.
questions.
Thank you, Florette, very much. And thank you, Karen, for an excellent, really interesting presentation. And I must say, I did some research that used 2 different languages, and that was very challenging. So to hear you mention 12 different languages, I'm really quite amazed, and huge congratulations to managing such a complex cultural linguistic challenge. So thank you for that presentation. We now have a short break, everybody, to have a break from the away from the computer screen. So do grab yourself a drink, have some time away, and if you could return, please, at for those in Canada at 10:55 a.m. and for those in the UK, that's 3:55 p.m. when we'll start with our next 2 speakers. So if we can be back at 10:55 a.m. for those in Canada and 3:55 p.m. for those in the UK. Look forward to seeing you soon for our next 2 speakers. Thanks very much, everyone. But I hope you've all managed to come back and are looking forward to our next first speakers. So I'm not going to waste any more time. I'm going to hand over to our next speaker, Shelley Rotenberg, who is going to be presenting on visible minority immigrants as transnational carer employees amidst COVID-19. So I hand over to you, Shelley, and we look forward to your presentation.
Thank you. Okay, perfect. Yeah, so hello everyone, and good morning or good afternoon, depending on where you're watching this from. Yeah, my name is Shelley Rotenberg, and I'll be talking about the visible minority immigrants as transnational care employees amidst COVID-19. Okay, there we go. So just to jump in and introduce, so this project that I'll be talking about is part of a larger 5-year study that aims to understand the experiences of Indigenous, visible minority immigrant, and European immigrant transnational care employees. But my research, smaller project specifically, and what I'll be talking about today is just focusing on the visible minority immigrant TC population. And so who are TCEs? So more specifically, they're individuals who balance unpaid emotional, physical, and or financial care to their adult family, friend, or relative in another country with some type of work. So oftentimes this is paid employment, and then they're living in Canada in this case. So a bit of background is that in 2018, 7.8 million Canadians reported having provided care to a family member or friend with a long-term health condition, disability, or aging need. And more than 1 in 5 Canadians are foreign-born, and the majority of them are from non-European countries. So the number of immigrants in Canada who are providing transnational care is growing due to the increase in migration, mobility, and aging populations. So for the methodology, arts-based ethnography was used, and this was important. It was nice that David talked quite a bit about the ways that artwork you can express yourself, and so that was really important because we did have some interviews that were not all in English. We had some in Arabic and Spanish, and so sometimes things can get lost in translation. So submitting art pieces, whether it was photography or writing, or again, more like in physical type of artwork, that can help convey extra things and make sure that the words are contextualized and conveying some extra meaning in addition to the interviews. And so everything was analyzed in NVivo 12 Pro, and then all the names in the research and in this presentation are actually pseudonyms, and most participants did actually pick their own. So for the participant recruitment, The inclusion criteria was that they had to be 18 years or older, providing care across borders, living specifically in London, Ontario, because that's where this research is based from, and working in paid employment or volunteering. And so it's important to add the or volunteering aspect because a lot of immigrants, when they come to Canada, their work experience or education isn't recognized or seen as reputable. So they may not be able to find paid employment right away. So oftentimes they still want to gain that work experience. So they'll be volunteering when they get here. And in total, we had 29 participants, so 15 male, 14 female, and representing 10 different countries of origin. And so the main ones were Colombia, Nigeria, and Syria, as well as we have others represented too. Okay, so now I can jump into my findings. I have 5 themes that I'll be going over, and some of them have sub-themes as well. So we'll jump right into that with the first theme. So the first one I'll be talking about is the impacts of COVID-19 on economic, health, and social costs of caregiving. So COVID-19 created greater financial hardships for care employees, and this was due to a couple of reasons. So oftentimes they experience a decrease in income, and this could have been because of a job loss or the fact that maybe their work became more precarious. And then as well, an increased financial need from their care recipients in the country of origin. So maybe their loved ones back home also lost a job or experiencing more precarious work. So you have from both ends that there's greater financial hardships. And so just to support this with some quotes, so Anna from Colombia said that it's been really bad due to the pandemic, work has slowed down and that has reduced our income. So we've had to reduce the financial support that we give. And then again, from that flip side, so Friday from Nigeria, so he said with the economic situation, how things are back home, people are not holding back to ask for something they need. So it's from both ends, you maybe have less money to provide, but there's more people, or there's just a greater need from your care recipients that you're providing to prior to the pandemic to help them financially. And so this can be quite stressful and unfortunately put a great burden on the care recipients, the care providers. And then another aspect, so if we look at mental health consequences, you know, the pandemic has been stressful for mostly everybody, but there's already a high amount of caregiver burden. And so this can create just even additional stress on top of that. And then there's that new additional worry of specifically care around COVID-19, making sure that your care recipients are following guidelines, that they're not going to get the virus and become sick or ill. And because you're across borders, it's even harder to care for them if that were to happen. So some participants described this, you know, that there's a pandemic, there's so much uncertainty and trying to figure things out on my end, but it doesn't change the fact that you still need to continue providing care. And so Nina described that, you know, it's been challenging. And then Augusto said, because you're always paying attention to what could happen, and when you're so far away and you don't want anything happening to your family. So there's a lot of added worries and things that are affecting the mental health, having negative consequences for care recipients and their caregivers. So unfortunately, that's something that they've been dealing with. Sorry, I see a white screen, and so it shouldn't be in my presentation. I'm wondering if others are seeing a white screen or if you can still see my slides.
I also see a white screen.
Oh, okay, let me see.
Try flipping back up and then down through the slide, and if that doesn't work, I'll take it down and then load it back up for you.
Okay, yeah, for some reason it's not even letting me go forwards and backwards anymore. Even though I'm pressing the arrows, maybe it's frozen? Yeah, maybe if you could just unshare and reshare again. Oh,
Is it still a white screen? I just moved it up one and down one. Is it on the findings slide for you now, Shelley?
I did quickly see the findings slide and now it's back to the white screen. Oh, yeah, so I see the findings. It's slide 12. And then 11. Okay, I don't know why 11 is a white screen because I don't think that was in the PowerPoint slides when I see
No,
it.
I can see the slide fully right now on my screen.
Oh, okay. I don't know why I can't see it. Okay, maybe if I could pull it up and talk from my computer. I just can't see that particular screen. Oh, sorry, everyone.
No problem. If you just want to talk about this slide with your presentation there, just let me know when you're done and I'll move it to the next one.
Okay, so let me just go to slide 11. So yeah, so one more issue is that if we're focusing on the social costs of caregiving, so there's increased isolation for some caregivers, and this is already a problem even prior to the pandemic of informal caregivers feeling socially isolated. So this could be due because they have less access to their social support system, they're feeling less able to ask for help, or they're not being able to see their loved ones back home because of the travel restrictions. So that's the last part of the first finding. So now let me see if I can change it myself. Oh, yeah, I'm not able to. If you're able to go to the next slide, please. I guess just on the white.
It went back to white screen for it? Okay, just one moment. I'll take it down and put it back up.
Oh, okay. Thank you so much. Yeah, I guess I could read the quote that I have on my end. So just to add to the finding of, being more socially isolated, Arif was one of the participants and from Kenya, and he said that it's really hard sometimes. Like there are days in which I feel like talking to someone, but I have no one to talk to. And so, okay, I see slide 11 now. Okay, let's see. Oh, perfect. Okay, we're back. And then Anna said loneliness, being away from your family, away from your country of origin is another challenge. So not only, like before are they physically separated, but then it could be harder emotionally to keep in touch with their loved ones. And also just during the pandemic here, if they have friends and family in Canada, then there's that added level of feeling isolated. And then going into the second theme, so the complexity of transnational caregiving. So the TCEs are redefining the term primary caregiver because oftentimes you're providing care physically and in person. And so because the two main forms of care for TCEs are emotional and financial, that kind of flips the script, I guess. And so you're looking at the emotional aspect. So Antonio from Venezuela said that when you emigrate to another country, a piece of your heart remains in your country of origin and with your loved ones. And then this is one of the art pieces that participant submitted. And then some additional information on emotional. So Alexandra from Barbados, she went in to talk about how we talk often, how COVID-19 is affecting him because he can't work, and that she tries to talk to him and let him know that things will get better. And similarly, Marcella goes on as well to talk about the emotional caregiving, that telling them we're going to make it and that we're going to be together soon, so that eases their worries a bit. And then on top of that, some participants are also, either one or the other or both providing financial care. And so Jemmy from Uganda said that she has to take care of her care recipients' basic needs. So that could be everything, food and bills like hydro and water. And so not only are they sending money, but they might be paying for the care recipients' expenses. And then AD from Pakistan said that I have to have that money for caregiving. It's not optional, it's part of whatever money I make and has to include that money. So he's prioritizing this, making sure that he's including it in his budget so that he is able to reliably send this regularly and maybe the same amount as often as he is. And then, so another complexity of transnational caregiving is looking at why they provide care. So culture had a very strong influence on visible minority TCE's reasons for providing care. And this can kind of be divided into some smaller themes such as family, gender, and religion. So this is one of the art pieces that a participant submitted, and I've just copied part of their passage here. So from both a cultural and moral perspective, I as a fruit feel a sense of obligation to extend the same act of kindness towards them or others that have impacted me in any way. So here he's talking about his parents, which is who he's providing care for, and just that aspect of giving back to them because, you know, they have helped him up until this point. And then some other participants said there's this expectation that women have to do the caregiving. If you raise a girl, you're raising the support system of the family. And so that was Lulu in Zimbabwe. And it was very interesting because I had some male participants still cite gender as the reason, but they said, you know, maybe being the eldest male in the family or the eldest son, that you are seen as a provider, so you have to financially care. So there's a bit of a difference. A lot of participants did do both emotional and financial. But sometimes the women were more likely to provide emotional care as well as financial care. And then looking at religion, Sabrina from Pakistan said, as a Muslim, you know, child, you're supposed to look after your parents always. It is one of the basic, I would say, teaching of Islam. So a number of reasons within this cultural context of why participants feel that it's important, or they feel like they maybe have to provide care across borders to their loved ones. The third theme is TCE's experiences on work-life balance. So some of them have described coping strategies to effectively manage the multiple responsibilities as care employees. So setting boundaries and time management were two themes that came up, or two sub-themes. In terms of setting boundaries, Louis from Colombia said that, you know, you have to tell them, I cannot send you the amount of money I'd like to every time, or an amount that would cover everything. And then similarly, Anela added to that. So she's from Haiti, and she said having to create that boundary with him and really trying to help him understand that I don't always have enough money. So this, you know, jumps back to those financial hardships that they're experiencing. And then same with maybe financially having to set boundaries, also time management. So Martina says, you know, talking to my parents is a priority. So she prioritizes that and makes sure she makes time in her schedule. And then Rasha from Syria said one can manage their time. For example, for me to contact family and my son, it is a certain time frame in the morning or late at night. And so then it might be more important to just really make sure that's a part of your daily schedule to emphasize that emotional care that you're providing to those back home. And then there's some participants that described struggling to maintain a balance, and there was even some that said it's not very realistic or achievable to even find balance. And so, for example, LA from Nigeria said, you know, that his income decreased. A lot more people can get more desperate and more in need back home. So we had to squeeze out a bit more of the little that we're making, and the balance has gotten more difficult. And then Kofi from Nigeria as well said, how do you balance employment and caregiving? I don't know if there needs to be a balance. So you just have to do everything you need to do. But I think to the extent that something does not kill you, you are balanced. So this was an interesting personal definition, and maybe not very healthy if they are feeling that they have to give that much, but it speaks to the burden that these people had both prior to the pandemic and even during the pandemic, and how that became even more of a problem. And so my fourth finding is looking at the role of geography on the nuances of time, space, and place. So providing care transnationally creates unique challenges, and one of them is the restrictions on the ability to provide that physical care, which is what most caregivers do if they live close by to the care recipients. And so one excerpt from Caring Without Hands, which is a poem by Kofi, and he writes, my caregiving of you, Mama, is a hand that can't touch, a kiss you can't catch, but that's the way of the new world. And so highlighting this aspect of they do want to be with their care recipients, and oftentimes they're trying to bring them to Canada, as Sebastian points out here. So he says that you want to bring that person over so they can be with you. And to bring her here, well, you need financial stability and you have to be eligible to sponsor someone. That speaks to then that, you know, pressure to work and paid employment and to be able to earn enough money to send back home, but also try to even, you know, reunite and have them all live here in Canada. And then another challenge is a lack of understanding or disconnect between carers and their care recipients. And so this was highlighted by a number of participants, actually. So Maria said that I do feel there's a disconnect and people don't know what it's like to live abroad. They have false expectations that things are very easy. So participants described how their care recipients would think that they're earning all this money. So it's like, why aren't you able to send more back? But they don't understand all the expenses and the cost of living is higher. So then there's that lack of understanding there. And then another participant said that some people give you the worst case scenario, and then you have to be able to, being abroad and as well trying to find out the facts of what's the real situation on the ground before you send the money back home. So, you know, if you haven't been able to travel back home and you've been living in Canada for quite some time, there can be a misunderstanding on that end too, to know, okay, how dire is the situation? How much do I need to send home? And, you know, is this need legitimate? Is what I'm sending back is enough? So that's another aspect of the distance that can create more challenges for transnational caregiving. And then there's also more practical barriers, I guess, with sending money or staying in contact. So sometimes they cited that financially providing care is difficult because some of your money ends up going to the service providers who are helping you send the money back home. And I remember one participant even said that they'll sometimes ask a family member or friend who's going back to their country of origin to bring money with them so that they can know it gets back safely. And then in terms of staying in contact, so there's issues with connectivity. Sometimes if the internet bill doesn't get paid or just cell phone coverage isn't great, there's a lot of issues of you can't hear each other, it's cutting out, calls are dropping. And then there's the time zone issue. So Amar highlighted that, was saying the time that we are up, they are sleeping and vice versa. So it's really hard to catch them. And then Noji was another participant that spoke to the time zone difference. And specifically in their case, it was a 6-hour time difference between them and their care recipient. And then
2 minutes left, please, Shelley. Thanks.
Okay. So my last finding is the impact of COVID-19 on care workplace accommodations. So most participants did not know of any, or they knew for a fact that there weren't any caregiver employee accommodations. And so COVID-19 created some circumstances in the workplace, and changes actually benefited TCEs. So Lulu said, that having sick time, which was something that was introduced, she doesn't have to decide between, losing money and staying home or being able to go to work, but you're not feeling well. And then Alajid said that he thinks it's opened up the way organizations have realized, to keep this person, they have to be more understanding. So a lot of participants wanted more compassion, also more flexibility with being able to work from home and balance that with in person. And so those were some new insights that came about that participants said that they really liked. And then, so just to summarize, the findings highlight the complexity and the nuance of visible minority immigrants and their experiences and the impact of COVID-19 on caregiving, mental health, and workplaces. And then tying it back to the implications of building back better after COVID-19. So social work is rooted in social justice. And if they can better understand the inequalities that the specific group experiences, then they can help reduce the inequality and address the specific needs of this population by providing holistic services so that these people don't get left behind either in the workplace or in a community setting, that their experiences can be acknowledged and then they can receive the help they need. Because some of these participants very much felt like they couldn't ask, especially their immigrant status. They didn't want to ask too much because they're already very grateful for being in Canada. So this is something that social workers can be more aware of so that they can make a difference in their lives. And then the links that were shared previously in the chat, those ones are related to my presentation. So those are just some links for the workplace standard that is trying to be implemented to create more accommodating workplace policies for care employees. And it's more culturally sensitive with this research focusing on visible minority immigrant TCEs. So that's my presentation, and thank you so much, everyone, for listening. And if anyone has any questions.
Thank you so much, Shelley. That was really interesting. I was very fascinated. We had a change in law, the CARE Act 2014 implemented in 2015 that broadened the definition of a carer. And it really encaptures this idea that care isn't just physical care. So to hear this in the context of transnational, that care isn't just about physically helping somebody. And of course, in the context of your study, that wouldn't be possible. I just find it really fascinating. So thank you ever so much for sharing it with us.
Thank you.
Florette, I'm going to hand over to you. And well done, Dave and Shelley, on managing the few technical issues we had there so well. That was very well done. It's always a bit stressful, isn't it? So well done on that. Florette, can I hand over to you for any questions in the chat? I know I've posed one already. So over to you, Florette. Thanks.
Thank you very much. Thank you, Shelley, for a very interesting and thought-provoking presentation. So Peter asks, a quick question about methods.
Mhm.
I was interested that participants chose their own pseudonyms, as I have read a few studies now that have adopted this approach.
Mm.
Do you just invite the participants to suggest a pseudonym? How do they respond to this? Did they value it? Do you think this one way of giving voice to participants?
Yes, yeah. So participants were given the option, to pick their own, and I do think that this is a way of giving voice to participants. When it comes to qualitative research, specifically not wanting to view participants as numbers, to just assign to make it more personal and meaningful. So if for obviously confidentiality reasons, we don't want to use their real name, but we still want to get across that this is a real person. And with the quotes, we're telling part of their story. We want to accurately represent their experiences, and we want people to see, and we want to humanize them by giving them, still a name to represent where these words are coming from. So I think that's very important in terms of the qualitative research and trying to be more have participants be co-researchers and emphasizing their experiences as really validating, and it's just as equal as maybe experts who are providing secondary research. So in this type of research, it's very important to have their voices heard and to have a voice to at least a name.
Okay, so I think following this presentation, Peter is he intends to adopt this approach in his future qualitative research. So obviously this is having a real big impact. We also have a message from David Watt that says that it was very interesting, Shelley. Thank you. David Collins says, good to see the use of arts approach. It's very powerful, particularly in a multicultural context. And I was actually going to ask a question related to that. What kinds of art did you get as a result of this research? Was it a lot of was it personal experiences, or was it more on an emotional level? I'm just curious about that.
Yeah, so I would say it was a bit of both. I featured a couple, but you can't fit everyone's art piece in the presentation. The one that was like a map, I thought that was very cool. Maybe I can figure out how to get back to it. It was really good. I think the participant who submitted it said that it was one of their family members who provided this one. So definitely, at least this one, because it was talking about emotional caregiving. So definitely the feelings of again, how geography and distance plays a role, and really still feeling connected, but then there's that hardships of being separated. So a lot of times, and some people instead, participants submitted some type of photography of their family members, just again emphasizing that family ties don't diminish even if you're not in the same country anymore. And then artwork, so I did feature later down, I won't go back to it, but one of the poems, so there was a much longer poem, but that was just a piece of the poem. It was called Caring Without Hands. So we accepted all forms of artwork, and yeah, oftentimes it symbolized something that was important to them. Some people submitted maybe an object that they brought from their country of origin that kind of represents some sort of cultural meaning or relation to family, or it's something that kind of gives them motivation or hope to keep providing care, and when they're feeling down, that reminds them of the reason they're providing care. And again, sometimes that's very cultural. And then one participant, I think, even took a verse, some sort of scripture that helped them and kind of related to their caregiving experience. So quite a variety of art pieces that were submitted, and all very different and unique, but very, very meaningful.
Wonderful. And Colin Watt also agrees with the pseudonym as being a very excellent idea. So that's the end of the questions and the comments on Shelley's presentation. So thank you very much. Back to you, Peter.
Thank you.
Thank you very much, Florette, and thank you again, Shelley, for a really interesting presentation and for bearing with us while we had a few technical issues there. It was really enjoyable. Thank you. So now I'm delighted to hand over, last but certainly not least, to Petra Roberts for our final presentation of this morning's this afternoon's conference, who's going to be talking about a roadmap to recovery, who is left at the side. So Petra, I'm delighted to hand over to you.
Okay, thank you very much. Just let me make sure I know what I'm doing here. So Dave, I just need to use the arrow, or what do I do to move the stuff?
Well, there's the control panel on the left-hand side where you can click the down arrow, or if the arrows aren't working, you can try page up and page down on your keyboard.
Okay, the down. Okay, good. Okay. I'm a Zoom person. Never use WebEx. So thank you. Thank you for. I was able to, although I was teaching this morning, I was able to hear most of the participants and got a little piece of the keynote speaker. I'm looking forward to listen to him on the record. Anyways, my time is clicking. I'm Petra Roberts from Ryerson University, Renaming in Process. And what I'm going to speak about today is a roadmap to recovery. It's listed who is left at the side on the itinerary. I made an error in typing who's left behind, but basically it's who's left behind or on the side. And I would sort of contextualize this a bit, my study. The global pandemic hit the Caribbean severely, as it did Canada and the rest of the world. And one group badly affected were young single mothers who had transitioned from residential youth care. And this came out of my doctoral study, looking at alumni from large residential youth care homes in Trinidad and Tobago. And so I interviewed 24 men and women, and what came out were a number of positive experiences, but transition and discharge often led to hardships, with women suffering more than men. Homelessness led to sexual exploitation of women, who often soon became pregnant, and unplanned pregnancies, which then often have lifelong consequences for young women, etc. So during the pandemic, I interviewed. So my follow-up was to really now find out from women themselves what were their experiences upon transitioning and their first pregnancy. Due to the lockdown and no international travel, I did interview 15 women ages between 18 to 29 who became pregnant 6 months to 1 year after discharge from home. And I used WhatsApp video audio recording to do these interviews between January and April of 2021 this year. So the research questions did not ask specifically about poverty, but the women were talking about their experience during the, within the lockdown, like as it was happening, and they talk about their income and their experience financially of the pandemic. So I'm sure most of you know where Trinidad and Tobago is. It's the most southerly island, sitting right on top of Venezuela, with a population of 1.3 million people. The economy is based on oil and natural gas, but as we know, the prices of oil and gas over the pandemic has greatly reduced. So the orphanage system, the children's home, this orphanage was established in 1857. And just to kind of put again, just a brief history of where these women would have come from. So the system of orphanage care developed from a socioeconomic history of slavery and emancipation. At the end of slavery, during emancipation, the plantation owners did not want to pay the freed enslaved people, who also did not want to work. So they got indentured workers from India. This is in the east of Trinidad. This was the first group of indentured workers arrived here, and a number of families or children end up often on the trip there, as well as during the work in the plantation. Parents died, etc. And the Anglican Church, as with the plantation owner, built this home. So in 1857, this home was established, and it's now called St. Mary's Children's Home. And again, this picture just showed that the history from slavery, emancipation, indentured labor. This is the other home that was established in the Port of Spain, the capital. Was called St. Dominic's Orphanage. It's now St. Dominic's Children's Home. This was established just about 10 years after the first one. And whereas the St. Mary's Home specifically was built on the plantation, on the former plantation, this home was not built on the former plantation. It was built in the city, and was the same with children who were on the streets during that period. And just to kind of put it in context, these homes they're not like homes which indigenous Indian residential schools are. It started off as children who are orphaned, or children who don't have parents, or parents died, and then moved to children who needed a place to stay, families with may have drug abuse, etc., and also families who saw the place as a home, and they would actually bring their children to live there because of education and etc. that they can get. So this again, the home. This was one of the children at the home who saw herself as her goal is to become a teacher, a music teacher, and but actually ended up being one of my participants who became pregnant within 6 months of leaving the home. Okay, so and what was happening during the pandemic, the Trinidad and Tobago government developed a roadmap. Oh, that's the kind of other me. Roadmap for transforming the economy, a new economy and a new society. And on that roadmap, there were 3 pillars of the recovery, which was transforming the economy, making food security a reality, leave no one behind, making equity and empathy central. And they had discussions virtually with different community leaders, community groups, etc., in this recovery process from the pandemic. Transforming the economy, as I said, because with what was oil and gas, the prices I think it went down to probably even at $1 US at some point in time. There was this need that one need to start looking at other forms of income, as opposed to the dependent on this one source. Making food security a reality. Again, the pandemic showed that a lot of food was being imported, and this is a country that actually, Tobago, the island, used to be really a major exporter of food and vegetables to Trinidad. And both countries heavily rely on imported food. So the pandemic showed that with borders closed, etc., there was there was a struggle because of the over-reliance on food, on imported food. And leaving no one behind, making equity and empathy central. Again, although that pillar was there, what was still happening was when you look at there was not a gender analysis in the government's roadmap and policy. So what you found is that there were a lot of women in low wage and unprotected employment, a lot of self-employment and in the informal economy. This includes like food and street vendors, hotel workers, domestic workers, in-home care workers, stores and etc. And everything shut down, and you found that the opportunity. The government was issuing some relief checks, but they were using the national insurance system. And with the national insurance system, it does not include self-employment, and it does not include informal economy. So you had suddenly a number of the majority of women who actually income just stopped immediately and continued for a number of weeks during that first lockdown. Eventually, some opportunities were created, but the informal economy, which you would find that women like my 15 participants, who will be doing hairstylists, who will be nail technicians, who will be street vendors, who will be selling food, etc. They had no protection. Whatever savings they had completely depleted during the time. And so this was one of my participants in the study. This was a alumni from one of the homes. And I was in Trinidad last 2 weeks, and we met, and she came with her, just as a salesperson, she came with her bags. And what she does, she walks in different communities. So as she was coming to visit in my community, she decided to walk with her bags, and she made it continue after her visit to make sales. So what with the pandemic did, she could not go out during the pandemic, as well as the stuff she sells. It's like phone chargers, knives, whatever could be stocked in these bags. And so her income cut completely. And even now the pandemic is still obviously present, and there's still a curfew, etc. And so she now can get out, but with mask on, and continue to be on that self-employment, that precarious jobs and income. So okay, and so the budget after the whole pathways and etc. The budget came out on October 4th, and one of the things they removed was value-added tax on certain food items. Value-added tax on certain items. So as of November 1st, which was Monday, these items were now removed, and I can't remember the amount of the percentage of the value-added tax. However, so these were some of the stuff, and it's different like in Trinidad, and I don't know about the UK, but not in Trinidad, in Canada, where foodstuffs are not under the what we have in the GST, but these were there. So the whole stuff, which I want to just make that connection from the women in my study, and the women in general, is that you cannot you have to bring in a gender analysis in any kind of planning and policy making for pandemic recovery. Women would have different experiences, as I think previous presenters spoke about, that the role of parenting, the education, etc. The women had to be the one to be teachers, but also still those who were able to go to work, etc. So a gender analysis is also always needed, definitely now in the pandemic recovery. Sharing the nation resources to address the growing gap between the rich and the poor. Trinidad is considered a middle-income country based on the reliance on oil and gas. But again, you can see there was always a division of the rich and poor, and the gap is even growing wider. So it's important to kind of look at sharing the nation's resources. Diversifying the economy. Agriculture and food security needs to be looked at. Cruise tourism, which most of the Caribbean depend on. You need to kind of look at something different. Although again in Tobago there's a whole thing about building the Marriott Hotel, etc. Again focusing on tourism, even though they saw the reality of what a pandemic can do. Income support grant, etc. One of the participants spoke about there was a baby grant issued for a previous government, and I think $1,000 or something. So for parents with newborn up to 1 year, I believe. This she found helpful when she had a child at that time, but that was a pilot study and did not continue. So a form of grant system in the interim could be in place. Expanded the national insurance access to those with the informal economy. So this is my presentation, and the piece that this represents what a majority of women who leave residential care, a majority of women who you're self-employed, who do not have access to the social insurance safety system, they are the ones who, when we look at recovery, we need to keep looking at how recovery would look for women, and that they're not left behind or left at the side of the road in this roadmap. So thank you for listening. That's it.
Thank you very much, Petra. Really interesting in conversation and presentation, and really interesting way to finish the conference, particularly hearing experiences from beyond the UK and Canada, and actually looking at Trinidad and Tobago. I wondered if I could just ask a quick question before I hand over to Florette for any questions. You mentioned the women becoming pregnant when they've left the children's homes, and I wondered, with the challenges the women are facing, securing employment and sort of difficult employment, what happened in terms of the care of their children that they'd had? How did they manage all of sort of the difficulties, as well as, of course, they're now a mother as well?
Right. It was quite challenging for most of the women. And so it ended up like you will get some financial help here, you would get some financial help there, some charity organization and family members will help or not. But a lot of the women kind of had to be creative. And one of the positive things that come out of residential care is that these women are quite strong and they're quite resourceful. So again, doing somebody meals, doing somebody hair, cooking and just anything to bring in some income. So that kind of center what kind of helped a number of women in their parenting, and the baby grant, when it was around, was also a help.
Thanks, Petra. It's really nice to hear the language of resilience, and certainly in the UK, from a social work point of view, emphasis on strengths-based approaches now, building on the strengths that clients have, and tapping in really into their own resilience. So it's really nice to hear how that's sort of echoed, and a focus on not just the difficulties the women face, but actually the strengths that they have, and how they can be tapped into their resourcefulness. I think there are some queries and questions in the chat, so I'm going to hand off over to Florette. I'll read those out to you. But thanks again, Petra, for a really interesting presentation.
Thank you.
Thank you very much, Peter, and thank you, Petra. That was very interesting. Jess Wagner asks the question, now that the differences have been highlighted, are there any campaigns that are looking at change or calling for change? Is there anything happening to make that change happen?
Yes. There's like I spoke to MSJ, the Movement for Social Justice, with David Abdullah, who they are pushing for larger change in political change as well as structural change. There's a Caribbean Research, CAFRA, can't remember how the Caribbean Association for Feminist Research and Action. They have made presentations to government in really pushing for government to take the serious gender analysis, because there are studies out there. So it's not to say that there's nothing out there. There are studies out there that would show that you need to kind of look at the experience that women would have, disaggregate even in the health part, as well as to show the pandemic health-wise, how it affect women, how it affect men. So there are grassroots organizations who are pushing. The big one is to get allow national insurance to be expanded to get people who are self-employed to get into the system. So there's constant push to get things changed.
Thank you. Susan White asks the question, could you expand on the connection between young women leaving their children's homes and getting pregnant quite quickly?
Right. What tended to happen, again, from my original study, and I would spend time within the home, the women from the home, they one can even argue that because of the charity model a bit, most of the women would leave with completed high school. Most of the women would leave with what I sometimes call social capital, that they've been exposed to every Christmas they go to the Prime Minister's house, every whatever, So they come out with what I would say is social capital. But when they reach out there, most time they return to families who they have a disconnect, because these homes, you stay until you're like 16, 17, 18. So they would return to families who remain poor and who in a different class system, one could argue. So so that's one piece. But the other piece is that what they miss in the homes and leave-in is sex education, major a lack of any kind. Very protective. The homes protect them in a way. They're drivers to take them everywhere. So I think what tends to happen when they come out, without that, and there's a disconnection with the home. You get out and then you're out. Like you kind of like there's kind of like not a nice open door to get back in. So they get out and they really sometimes don't have that kind of street knowledge. And there's a view of children from the home, kind of like a negative view out into society, but is not in touch with the reality of their experiences. So with all of that, they ended up, the homelessness becomes really quickly, they become homeless. And then that's sort of like, I don't know, call it the negotiation with partners and inability to access for free and accessible birth control methods, pregnancy result with the women. And again, options for terminating the pregnancy is not always easily available.
Okay, thank you. And Vasily Crawford makes more of a comment than a question. She says, thank you, Petra. And there is a link to the support from family and friends abroad, which I think is not really appreciated by many professionals in the UK. I sometimes see adults being criticized in court reports for sending money to families abroad without any understanding of the context.
Okay.
So that's more of a comment than a question. Did you have anything you would like to add to that?
Will she say that it's not supported by, like, workers don't support? Was it that you were saying that workers are not supportive of money being sent?
She says I think it's not appreciated by many professionals in the UK, where there's a link between support and family and friends. She now says they don't support money being sent.
Okay. But that has not been my experience. That's not been my experience. I know I've listened to a program recently, and it's not about Trinidad, but where even during the pandemic, that the amount of remittances that families keep sending, that sometimes you have to remind them that at least they should keep something for themselves. So the commitment to help is really strong. So, but that's not my experience. That there is no.
Okay, so there might be a difference between what the UK experiences and what has been your experience. Okay. Yeah. Peter asks another question. I was interested in the policy reference to not only making equality central, but also empathy. I wondered if you think a gendered analysis in relation to how we offer empathy in the recovery is important.
Yes, I do think it's important. Yes, I do think it is important.
Okay. And that is it for questions at this point. So, Peter, I'm going to turn it back to you, and thank you very much, Petra, for this thought-provoking presentation. Thank you.
Thank you, Petra, and thank you, Florette, for a really interesting final presentation there. Sorry for all those questions. I was just really quite taken by reference to empathy in policy as well as equality, and the yeah, I found that very fascinating. Really, we talk a lot about empathy, don't we, in social work? So to see empathy explicit in policy was really, really interesting. So thank you to our speakers. We now do have a short period of time if anybody has any final questions for any of our speakers. I did want to offer the opportunity to David Alper. There was a question, David, you had, or more a suggestion really, in response to Karen earlier, and we didn't really quite get time to perhaps enable Karen to comment on that, or for you to comment on that. David, I wondered if you'd be happy to unmute yourself and just expand on that question and give Karen an opportunity to respond.
Well, thanks, Peter. I'm actually looking for my question that I put in the chat. I don't know if is Karen still on the call?
Sorry, David, I've put you on the spot there, haven't I?
It's
Yes,
okay, no problem.
I'm still here.
Would you like to respond?
Sure, I can. Let me look for the question.
I have the question here if you want me to go through it, Karen. If David, you made a really interesting suggestion, and I think the sort of the complexity, the cultural and language and those sorts of matters. So your suggestion in working with the most vulnerable, David, you said together, do you identify the ways in which institutions marginalize, minimize, and discredit the experience of racialized and indigenous people? And do you encourage your participants to identify how their culture and history can be sources of strength and inspiration? So it's a lovely question in the sense it kind of mirrors what Petra was saying, doesn't it, about the strength and resource of the women. So Karen, I wondered if you had any comments on that.
Yes, yeah, I really appreciate the question as well. And I think that you know, that's something in the program we definitely do and we try to do. And I think it's always important to be like reflective on that. And I think I encourage staff to do that. A strength, I think, of our program is that, as I mentioned, we have staff who speak 12 languages, and many of the staff themselves are immigrants to Canada. And so when they're working with clients, they've had an experience. And so they can use that, I think. And also, again, we encourage staff to do exactly what you list here. I think to be strengths-based in their work. And that's a core component of the work that we do. Yeah, but I really appreciate the question.
Great, thanks, Karen.
Thanks, Karen. Does anybody else have any questions or comments they'd like to make in relation to any of the four speakers that we've heard today? Four speakers, and of course our keynote speaker, who isn't here now, unfortunately, to respond to questions, but any comments that anybody would like to make or any questions for our speakers, please do put them in the chat or just unmute yourself and shout them out. Florette, I'm just going to ask you whether to check whether there are any in the chat at the moment.
There are no questions at the moment, but there are comments such as thank you to Petra. Thanks, Petra. Indeed, very thought-provoking presentation. Thank you for such an informative session. So I think, you know, we're certainly looking at a lot of appreciation for the conference or the presenters this morning. But I do have a question for Petra. And I don't know if this is beyond your research, Petra, but here in Manitoba, what we notice with women is that homeless women in particular, the homelessness is experienced very differently for women than for men. And so what we notice are that women are doing a lot of couch surfing. They go from one place to another. And so what we notice is that we don't see as much visibly the women homelessness here in Winnipeg as we do for the men. Is that the same experience? Is that part of the reality for the women in Trinidad and Tobago, where they are doing that surfing? And is that part of one of the reasons why pregnancy becomes a reality for them very soon after they leave the children's home?
hmm I would say yes. I would say yes because they would, and what tends to happen with the home that with the alumni is that they do develop this relationship with others, with other people in the home. So that they will do check in and spend time with different people. So I can see that sort of like couch surfing, kind of like I'm going to spend a night here or spend 3 nights here, etc., until then they move until then they move on. The thing also, what what I found with a number of the women I interviewed, who they end up with, and this end up the men, is really men who are like twice time their ages, much older men. So it's and the relationship, it's not always it tends to be abusive at times. So that there's this kind of connection between, yes, there is a level of like couch surfing going on based on just home sisters and brothers who they had, and then this last resort where it's and I would say it's abuse. It's an exploiting relationship with older men kind of being the rescuing them for some stability, quote unquote. So.
Okay. Do they fall into maybe a risk of being sexually exploited or falling into trafficking, sexual trafficking?
Mm-hmm.
Does that become part of their reality as well?
Yeah, interestingly enough, like when I spent a number of years in Trinidad, sex trafficking wasn't identified as an issue, but recently I have seen lots of signs up now for sex trafficking. So the women in my study never identified that as an issue. Yeah. But probably if I'm doing a study, another study with younger women, that may be an issue.
Okay. There is a question in the chat. Petra, is a sex education program being planned for the children's home?
Well, the 2 major big homes have just started a sort of transition units, and in it, yeah, sex education is part of piece, but it's usually how it's taught for now. It's usually, I would say there needs to be some improvement. But they are beginning the stage, and some of the participants did get information from schools. Some did get some information from schools, but with the homes, through the new units, it's on their agenda, but I am not sure what it looks like.
Okay, thank you. So we have thank you, Petra. We have now a question for David Collins. Some of your own artwork has been inspired by experiences during the pandemic. Do you feel inspired to create artwork inspired by recovery from the pandemic?
Yes. I think the kind of therapeutic aspect of any kind of artistic expression, I think, as the quality to be able to kind of support recovery. I can only say from a personal point of view, to start with, that certainly has been the case. But there's a huge amount of quite good empirical evidence, particularly when it comes down to more formal art therapy, about how useful it can be in recovery, and also quite a history in mental health in that respect. Probably going back well over 100 years, really. So I really do think it has got that potential, yes.
Thank you. And there's just a question, a general question. I was wondering if this conference, is this conference a 2-day event? And if so, is there a link to register for the second part? It is a 2-day event. The next day will be on the 17th of November. And I think if you go onto the same poster that was given out for this conference, you should be able to register for the second part.
Florette, just one quick point I can make. Is that okay?
Absolutely, go ahead.
Oh, okay. Okay. I did a quick look at the pillar on the 3 pillars and the one on equity and empathy. And what it really then speaks only about equity and really little about empathy in the details. So it's listed there, but yeah, empathy is not not highlighted strongly. Yeah. So just
Oh,
yeah.
you've disappointed me now, Petra. I was hoping to see empathy in the in the policy. But thank you for enlightening us on how far government had gone with empathy and policy.
Yeah, thank you.
However, maybe they believe that the empathy is part of the equity, you see.
Equity.
Because you need empathy in order to be able to get to a place where there's total equity. I think we got another comment that just came onto the chat. Thank you for the conference. Thank you for making it free. I am inspired by the title and will be reflecting a lot about this concept in my work as a social worker. And Ekta, thank you. She is such a godsend. Has mentioned registration link for the November 17th conference, and she has placed the link to do that. So thank you very much, Edka. And Anita Young says, thank you very much. So, you know,
Brilliant.
I certainly believe that that the different presenters have spoken about things that are really really important in social work, and they touch such varied areas that it's been very very inspiring. And Shivani says, thank you for arranging this conference. So that's it in the chat for now, Peter.
Thank you ever so much, Florette. And I just like to bring the conference therefore to an end. So thank you to those people commenting there. I agree, a really interesting afternoon for me, and for those of you in Canada, hopefully a really interesting morning. And it's really, I said earlier in my welcoming comments that I felt confident that social work really is the profession that can take leadership in leading recovery in our nations from the pandemic and the effect of the pandemic. And certainly hearing the presentations today has reassured me in that belief that social work can. Such a rich variety of presentations is something that I found really enjoyable this afternoon. The very different approaches, but recognizing some of the similar themes and the role that social work can have in a variety of ways in tackling poverty and in tackling equality. So I'd like to finish simply by saying that as a member of the conference organizing team, on behalf of the organising team, I'd like to thank all our speakers, David Croysdale-Appleby, David Collins, Karen Crow, Shelley Rottenberg and Petra Roberts, who did fantastic work. There's such a lot of work goes into the abstracts and preparing presentations and delivering them. So thank you to all our speakers. And thank you to all of you for attending this morning or this afternoon. And as Florette's already commented and Ekta's given the link there, thank you also. I beg your pardon. There will be a second day of the conference. This is the first time we've done a 2 half-day conference. We have so many excellent abstracts that we've put on this second day. So that is on the 17th of November, and Ekta's put the link there and it's on the poster. So we do hope to see you again for that. But as a member of the organising committee, we as an organising committee, this is the 3rd conference now, and we're always trying to build that better with each conference getting better and better. But we couldn't do that without the hard work and support of so many people who are involved, some of whom are very much behind the scenes. So before we finish, I would like to thank the other members of the organising committee, Sid Frankel, Florette Guiasson, who's been fantastic on the chat as always, Jessica Wagner, who organises all the Eventbrite and the registrations, David Alper, who's been keeping us to time very effectively, Judith Hughes, who helps organise with the conferences, and particular thanks to Sid, because unfortunately he can't be here today, but has put a lot of work into this conference. I'd also like to offer massive thanks to Ekta Badesha. Ekta organises all the committee meetings, she does the minutes of those meetings, she has oversight over all of the administration, and I don't think it's an exaggeration to say that there wouldn't be any conferences if it wasn't for Ekta. So huge thanks to Ekta, and similarly, there wouldn't be any conferences if it wasn't for Dave Nichols, who organises all the IT training on WebEx, and is very much behind the scenes throughout these projects, sorting out when we have technical difficulties quickly and efficiently. So huge thanks to Dave as well. And lastly to Bereya, who can't be here today, Bereya Henderson. She organised and did all the work on the poster, which is why it looks so professional. So huge thanks to Bereya as well. So enjoy the rest of the day. Have a good evening for those of you in the UK and a good afternoon in Canada. And we do hope to see you all on day 2 of the conference. Thank you ever so much and goodbye.